Psst, psst, psst. Hey, did you hear? Did you hear about the new podcast? Oi, what's it called? It's literally called Psst. There's a new podcast out right now. It's from Fil-CHA.
Filipinx AO sharing stories together, as in the Psst podcast.
Welcome to another episode of the Filipinx AO Sharing Stories Together podcast. Today is July 31st, 2021, and this is episode 7, and we're addressing COVID-19 misinformation in the Filipino community. Just a quick disclaimer, information is up to date as of today's recording / live stream on July 31st, 2021. But due to the circumstances surrounding COVID-19, information may have changed by the time you view this episode. I'm Leezel Tanglao. I am your host today, and I am super excited to introduce our guest hosts and guest speakers for today. I am a Bridge journalist and currently the Vice President of Fil-Pro, the Filipino Young Leaders Program, and the Project Director of TAYO, which is a virtual help desk to help Filipinos during COVID-19. And I am joined today by Rachelle Ocampo, who is who currently leads the public health initiatives at the through special events, fundraising, and communications at a community health center in New York City. She's also the co-producer and co-lead host of Makilala TV and executive director of NAFA New York. Welcome, Rachelle. And then we also have Jocelyn, who is a senior public health analyst for the Los Angeles County Department of Public Health. If any of you have anything to add, just wanted to welcome you for today's episode. Super excited to talk about our topic today. So Rachelle, Jocelyn, if you have anything to add before we move on.
Hi, everyone. Jocelyn Estiandan with the LA County Department of Public Health. As Leezel mentioned, I work in a section of our department that kind of liaises with the community. And so I'm very excited to be here and to share with you all today.
Yeah, no, you covered it, most of it. So thank you, Leezel. I'm also Fil-Pro alum, second batch, so represent. So thanks. It's really an honor to work with both of you. So very excited for this episode.
Great. So before we begin, I'd like to take a minute for some acknowledgements. A big thank you to the Association of Asian Pacific Community Health Organizations, AAPCHO, for making this possible. Also, this podcast was partially funded with the generous support from the Walmart Foundation. Our podcast is also produced in partnership with We Can Do This and the Department of Health and Human Services. So for today, we're gonna cover a topic that is definitely something that I'm very passionate about, and making sure that our community has the most accurate information possible, especially during COVID-19. Throughout the series, we've covered a lot of different topics that have impacted us as a community due to COVID-19. Most recently, the importance of disaggregate data. So really looking forward to the conversation we're about to have. So Jocelyn, I wanted to kick it over to you to go over some of the topics that have been a big conversation among our community with COVID-19.
Yes, and that is specifically addressing COVID-19 misinformation. So can everyone see my screen okay?
Yes.
Great.
Yep.
Thank you. Thank you everyone for inviting me for this important conversation. We're hearing more and more about how the spread of misinformation is a big factor in hesitancy and people's confidence in getting the COVID-19 vaccine. So it's so pervasive that the US Surgeon General released an advisory around confronting misinformation. He called it a threat to public health. So that's what we're going to talk about a little bit today. I want to start out by giving a couple of definitions of misinformation. While information has helped people stay safe during the pandemic, it's also led to a lot of confusion. Facts about COVID-19 have changed so quickly over the past year and a half that has led to several changes in public health recommendations. The recent change with the CDC's recommendations on masks is a good example. So back in May, when the CDC announced that masks were no longer needed for fully vaccinated people, the Delta variant was a small fraction of the nation's infections. Now that we know that it's the dominant strain in the US and how easily it spread, the CDC decided to revise the mask recommendation in areas with substantial or high transmission. So this will likely not be the end to changes and recommendations. We should expect to see further changes as we continue to learn more about COVID-19. But without very clear communication, many people have had trouble figuring out what to believe, what to do, which sources to trust, and how to keep up, which leads to a lot of misunderstanding and a lot of miscommunication. So I want to touch on two kinds of misinformation. Both include the spread of false information, but on one hand, false information is a result of confusion and misunderstanding and is spread without any kind of malicious intent. On the other hand, there is the type of misinformation, sometimes called disinformation, that is deliberately misleading or manipulating. And I'll talk a little bit about both in this presentation. So I want to start out by presenting some common myths and misunderstandings that we encounter here at the LA County Department of Public Health. The first being, when someone gets a COVID-19 vaccine, it causes them to shed the COVID-19 virus and infect people who are nearby. So this is a fairly new one. Vaccine shedding is a term we use to describe the release of any kind of the vaccine components inside or outside of the body. And it occurs only when the vaccine contains a weakened version of the virus. And so the fact here is that COVID-19 vaccines protect people from getting sick from COVID-19, which makes them less likely to shed the virus and infect others. And there's no way that the COVID-19 vaccine can infect someone or make them infectious, because none of the 3 vaccines here in the US contain any virus. So there's nothing for them to shed. So the takeaway here is that getting COVID-19 vaccine will not cause you to shed the virus.
And Jocelyn, when you say shed, that's like spread, right?
Yes,
Okay.
like it'll like come off of you, like shedding the virus is like being infectious, basically.
Okay.
So another myth is that the vaccine contains a microchip, and this is false. There are no microchips of any kind, no tracking devices in the COVID-19 vaccine. This myth is based on a fake video that was going around on the internet. It claimed that the pandemic is a cover plan for, implanting microchips to track people, and that Microsoft co-founder Bill Gates is behind it. And the Bill and Melinda Gates Foundation has gone on record to state that this is false. Like many other myths, this is a story that's really hard to stop, even though, it's been debunked over and over again. The next one is that a needle is left in your arm after you get a vaccine. You may have seen a video that appears to show a needle being left in a person's arm after they're vaccinated. But what you're actually seeing is a retractable needle at work. So there's syringes with retractable needles. They work by pulling the needle into a barrel of the syringe or a safety chamber on the side of the syringe after the vaccine is given. And these are used to reduce the risk that healthcare workers, so to ensure that they don't get hurt by the needle. You can always ask to see the syringe before and after you get your vaccine. Before you get the vaccine, you'll see a clear fluid inside the needle on the end. And after you're vaccinated, you'll see that there's no fluid left in the needle, and that the needle is inside the barrel or safety chamber. So please just know that there is no implant or microchips or needles that are left in you after you get the vaccine.
So Jocelyn, you had mentioned that it seems like these 2 myths are circulating via a video. Where have you been hearing, has this been circulating within our community? Is it like through Messenger? Like how are these videos being shared?
Oh, I think everywhere. So I think it's mostly Facebook and probably Instagram. I think mostly Facebook is where a lot of this misinformation is spread. Sometimes, Facebook does have some regulations. They're trying to be better about it, but people are now forwarding links via text. So watching videos that way or emailing. I mean, people just have a way of spreading this kind of misinformation.
Yeah, and it's also, our job as public health educators and just other people who are vaccinated to be the ambassador and stop the misinformation. So if you do see somebody or I've had titas who have messaged me on Facebook and shared this stuff with me, I've had to call them out and not publicly, but personally and one-to-one and just be like, hey, just letting you know this source has already shared that has been debunked. And, I had to actually explain to them so that they don't share it further. So I feel like that's a good takeaway as well.
Absolutely. Yes, we all should, if we know that it's not true. I love that you do call them out and, put them aside and ask them nicely that, and maybe even provide some facts along with it. Another one we hear a lot about is that the vaccine causes you to be magnetic. The COVID vaccines do not contain any ingredients that can produce any kind of electromagnetic field where you got your shot. All COVID-19 vaccines are free from any metals. Related to this is a video on social media also showing magnets sticking to people's arms where they got their vaccine. I don't know if anyone's seen that. This is sort of to prove that the vaccines contain microchips or that a needle's left behind, and it's totally just a trick. Magnets can be easily made to stick to skin with like tape or ointment. Plus the amount of metal that's needed to attract a magnet is way too much to fit any needle that's been given to you, that's been used to give the vaccine. So the COVID-19 will not make you magnetic.
So basically, don't believe everything you see.
Basically, yes. Now, this one's an important one. We do hear, COVID vaccines will cause infertility in women who want to become pregnant, or fetal loss in women who have already become pregnant. There's no current evidence that shows that COVID-19 vaccination causes any problems with pregnancy, including the development of the placenta. In addition, there's no evidence that female or male fertility problems are a side effect of any vaccine, including the COVID-19 vaccine.
Yeah, I know that this personally hits a string with me because even my own family member, like they absolutely refuse to get the vaccine because they want to get pregnant. Now I have two people in my family that have just come up to me and said like, because I want to have babies. I was like, there has been no evidence of infertility, and Jocelyn, you could share a little bit more about the study, but there have actually been people who have been part of, I believe, the Pfizer trial who didn't know that they were pregnant and then got pregnant after they got vaccinated, and they were able to have healthy babies. I don't know if you want to share a little bit more about that, but that was like my key thing for them is just like, people have been able to get pregnant after the vaccine.
That's correct. In the clinical trials, they didn't specifically include women who were pregnant, but they did have women who then got pregnant after getting the vaccine. So that sort of debunks that myth, definitely. Another one that we've heard is that people who have been infected with COVID-19 will have enough natural immunity to protect them. We don't know how long you're protected after you get COVID-19. So we do know that you can get COVID-19 more than once. Studies have shown that the vaccination provides a really strong boost in protection in people who have recovered from COVID-19 vaccine. So our recommendation is you should still get the vaccine, even if you've already had COVID-19. Another myth is that COVID-19 vaccines aren't safe and that they were developed too quickly. The fact is that it was developed very quickly because scientists had a head start, because they had already studied other coronaviruses. They studied both mRNA and viral vector vaccines. So while they're new, it wasn't just studied, when the pandemic hit. They've been there are studies for more than several decades. The government paid companies and scientists to work around the clock for this vaccine, given the urgency. Researchers use existing networks to conduct the vaccine trials, so they didn't have to start from scratch. And every step that is required to make sure the vaccine is safe and effective was totally followed.
Yeah,
so,
I feel like that when people talk to me about, the vaccine being developed too quickly, I just remind them, it's like the whole world is joining together to find a cure or vaccine for us. It's not just like people who are, just making things up. It's the whole world coming together to combat this pandemic. So it really just shows to you how important this is for every country to work together. So there have been people who are sharing their results and studies, and that's how it got developed quickly, is that there weren't that many as many like bureaucracy that that had to go through.
That's exactly right. They fast tracked it because it was such an emergency, and it was unprecedented. They followed all the rules, they followed all the safety protocols, but it's just sort of fast tracked because of the urgency of this. Now I want to spend a little bit of time of how to spot misinformation. 5 factors, the first being the emo factor or emotional factor. When you take a look at something, ask yourself if the content is emotionally charged. Does it make you feel angry, afraid, anxious? Examples of this could be like, conspiracy theories, xenophobia against China, vaccines are harmful to vulnerable people, where in fact that they're trying to protect the most vulnerable, overreach of government. We want to make sure that we look for objectivity. Misinformation is heavy on emotion, but it tends to be very light on facts. The second is a vague factor. So claims may be based on some truth, but are incomplete. So ask yourself, does the content seem heavily edited to remove important context? The solution here is to look for those details. Expect your sources to show how they came to their conclusions. The next is the money factor. These are headlines and stories meant to drive you to websites and buy stuff. So ask, does the person sharing the content have something to gain? Are they trying to sell you something? Are they asking for your personal information? So a good solution is to check for the source, look for an About Us section of a news, a site with a clear description, and avoid sites that ask you for your personal information. The next is the credibility factor. Is the content coming from a reliable source? Has it been verified by the organizations like the Centers for Disease Control and Prevention or the World Health Organization? Here too, we want you to look for objectivity. Misinformation, again, is heavy on emotion, but really light on facts.
Yeah, I feel like that's actually that's how I determine myself if it's credible. I love how you included the emotional factor, because I don't think of that intentionally. I just see something and I was like, oh my gosh, that is so fake. It's obvious to me, but for somebody, that speaks to them, and that's why it's so like you get emotionally charged. So for me, the credibility factor matters. So if I see something that looks very clickbaity headline, I know that they're trying to invoke some sort of emotion.
Exactly. And finally, the availability factor. So if you're in doubt at all about the information or it seems a little off, see if you can find that same information from multiple sources. See if the sources include reputable, highly visible news or media outlets. So find the same information. That's the solution. If it's important and it's true, chances are that it's going to have a lot of coverage. A good source for fact checking is politifact.com. If you go there, that's a great source for fact checking. All right, so some of our Filipinx Community Health Association or Fil-CHA members had some questions that they wanted me addressed, and so I'm going to go through them in this section of the presentation. What is the difference between COVID-19 and SARS-CoV-2? So SARS-CoV-2 is the virus that causes COVID-19 disease. So coronavirus is sort of that generic term that includes a large family of viruses. SARS-CoV-2 is a specific virus that can cause COVID-19, which is the disease. The World Health Organization uses a similar differentiation between HIV and AIDS. HIV is the virus that causes AIDS. And they say on the website that people often know the name of a disease such as measles, but not the name of the virus that causes it, which is rubella. So SARS-CoV-2 is the virus that causes the disease, COVID-19. In COVID-19, CO stands for corona, VI for virus, D for disease, and 19 indicates the year that it was discovered. SARS-CoV-2 stands for severe acute respiratory syndrome coronavirus 2. As the name indicates, it's genetically related to SARS that caused the outbreak of severe respiratory syndrome, SARS in 2002 and 2003, but it's not the same virus. That's why it's number 2. What are the different types of vaccines and their effectiveness rates? So all 3 vaccines work by teaching our immune cells how to copycat spike proteins, the crown-like spikes on the surface of the COVID-19 virus. Making the spike protein does not harm our cells. Our immune system sees the spike protein and knows that it doesn't belong, so our bodies react by building an immune response. It makes antibodies that act against COVID-19 virus spike proteins and prepares the immune cells. So this will protect us if we're exposed to the virus in the future. I can't directly compare clinical trial results like effectiveness rates between Johnson & Johnson and the Pfizer and Moderna, which are the mRNA vaccines. So I won't comment on their effectiveness rates, but there's several reasons why. The clinical trials for each of the vaccines were done at different times and in different locations. The level of infection in the communities and the type of and number of the viral variants in those communities varied. They each use different groups of people with different rates of underlying illness. So it's like really comparing apples to oranges. But what we do know is that all 3 COVID vaccines are safe and effective, and they do prevent severe illness, hospitalization, and death.
Yeah, I think that this is a huge point that I want to come across is that when people ask me, oh, which one should I get? I was like, the one that's available to you and around you, because it's free, at least in New York and in the US, I believe it's free for everyone.
Yes.
So in terms of effectiveness, as long as you get vaccinated, you are more safe than people who are not vaccinated.
That's correct. But I love that answer. That's the answer we give also. Which vaccine should you get? The one that you can get the most easily is the answer. So what about the controversy about the Johnson & Johnson vaccine? And this is specifically with regard to the use of fetal cell lines in the development of the Johnson & Johnson vaccine. So in various stages of vaccine development and manufacturing, some COVID-19 vaccines use cells originally isolated from fetal tissue, which is often referred to as fetal cells, some of which originally derived from aborted fetuses. The use of the fetal cell lines is a very sensitive and important topic, I think, within our Filipino community. However, the U.S. Conference of Catholic Bishops issued the following statement, and I'm going to read it out loud. Receiving a COVID-19 vaccine ought to be understood as an act of charity toward the other members of our community. In this way, being vaccinated safely against COVID-19 should be considered as an act of love of our neighbor and part of our moral responsibility for the common good. Given the urgency of this crisis, the lack of available alternative vaccines, and the fact that the connection between an abortion that occurred decades ago and receiving a vaccine produced today is remote, inoculation with the new COVID-19 vaccines in these circumstances can be morally justified. So I wanted to put it out there. What do you say to people who don't want a vaccine because none of them are FDA approved? So the Food and Drug Administration has given the COVID-19 vaccines emergency use authorization to Moderna, Pfizer, and Johnson & Johnson. And that's a temporary form of approval that allows people to receive the shots while the agency continues to study their effectiveness and their safety. The FDA came out with a statement that they want to ensure that the public knows that the review of full approval is one of their highest priorities. However, that a lot of additional information about manufacturing and clinical information has been collected since the EUA has been given that must be reviewed and evaluated by the agency as part of any application submitted. So any vaccine approval without completion of the high quality review and evaluation that Americans expect of the agency would undermine the FDA's statutory responsibilities, affect public trust in the agency, and do little to help combat vaccine hesitancy. So basically, it's following a very traditional, very cautious process for vaccine approval. However, everyone should know that before authorization, the safety data was reviewed by independent medical and public health experts. The 3 vaccines were studied in tens of thousands of volunteers, and now, millions of people, hundreds of millions of people have been vaccinated safely. And vaccines were tested in a diverse mix of people, including older adults, people with underlying health conditions, and people of color. So all 3 vaccines were found to work very well and to be equally safe.
So Jocelyn, I think it's interesting because like one of the reasons that I hear from people early on when the vaccines were rolling out, because they were hesitant, it's like, well, I don't want to be the first one to take it. But it's been like how many millions of people that have been taken? You're certainly not the first one or the only one that has taken it. So
right. Millions of people have taken it, and it has been proven to be safe and effective.
Yeah, and I've definitely heard this when I asked one of my family members, like, why didn't they want to get it? They said it's not FDA approved. I was like, why would I have myself plus my baby who was supposedly getting antibodies from the breast milk, and my husband to get this vaccine if I didn't think that this was safe and effective, and that I didn't trust the researchers who literally live and breathe this vaccine testing, and it's been tested with thousands and thousands of people, now millions of people. You know, it just goes to show you that, you know, that could be a reason for them now. And I think for me, like, of how I would respond to them now, I'm gonna ask them, like, you know, what will it take for you to actually get vaccinated? Like, even if it was FDA approved, like the normal way, would you have really gotten it? Is there any other reason you would, you know, you would actually get it at this time? It just, I don't, I'm trying to figure out what is the motivation for people to get it, because now people are getting $100 to get vaccinated in New York City, which just happened yesterday, is this new motivation. So I don't know if money is the motivating factor, but we'll see.
Yeah. Another question is, if I get the vaccine, can I still get COVID-19 and infect other people? So it's very rare for fully vaccinated people to get COVID-19, but according to an internal CDC presentation on the Delta variant, which was obtained by the press, infections in vaccinated people are rare, as I mentioned, compared to those in unvaccinated people. But when they do occur, people may spread the Delta variant strain just as easily. So according to the report, Delta variant is more transmissible than the viruses that cause MERS, SARS, Ebola, the common cold, the seasonal flu, smallpox, and is as contagious as chickenpox. So this actually just came out, I think, yesterday. So it's, I want to let people know that while very rare that fully vaccinated people will get infected, it is possible. It wasn't 100%. I think everyone knew that. But for the Delta variant, if someone fully vaccinated gets infected, then they are just as infectious as someone who's not vaccinated.
Then, you know, the argument that I would hear from the other side, the unvaxxed people, is, you know, what's the point of getting vaccinated if I'm going to get COVID anyway, you know? And like, my answer to them is that the biggest takeaway for me is that I have a less likely chance to get hospitalized. Yes, I might get COVID, but I might just get, you know, cold flu like symptoms versus being on a ventilator. That's a big difference, or die, like, which is what's happening with a lot of people getting the Delta variant strain. I feel like people associate COVID with getting COVID versus hospitalization and death. That's how I would respond if somebody were to say that to me.
That's exactly right. If you're vaccinated, so I don't know what the exact percentages is, but it's like 0.000, you know, 5% of people who are fully vaccinated who are hospitalized, and even smaller percent who passed away who were fully vaccinated. So it's extremely rare, and by far vaccination is the best protection.
And currently the Delta variant is the top strain right now, right?
Correct, in the United States, yes. If I pray, will God protect me? Of course, I can't really answer this question, but I want to read another quote from Father Nicanor Austriaco, who is a Catholic priest in the Order of Friars Preachers from the Philippines, who's also a college professor of biology and theology. He said, "It is a blessing from the Lord that we have safe and efficacious vaccines against COVID-19 so soon after the beginning of a global pandemic. We should all be vaccinated not only to protect ourselves, but to protect our neighbors, especially those who are elderly and vulnerable." So again, the best protection against COVID-19 is getting vaccinated. Vaccination will slow the spread of variants caused by and decrease the chances that new, even more dangerous variants emerge. So some tips that I just want to remind everyone about: wear a mask that fits and filters well. Avoid places where COVID-19 spreads more easily, including crowded places, closed spaces with poor airflow, settings where people are talking and close together. If you can, improve the airflow in your home. If you're having gatherings, open windows and doors. Avoid indoor spaces with poor airflow. Choose outdoor spaces for your gatherings and physical activities. Wash your hands often and use sanitizer often, especially after being in public places where there are surfaces that are touched by a lot of people. And stay home. Please, please, please stay home when you're sick. You don't know, and please get tested. That's, these are all the things that we know that stop the spread. And so I just wanted to put this out there as very important reminders. Will getting vaccinated affect my immigration status, and do I need health insurance? So no, your immigration status will not be affected. Anyone can receive the COVID-19 vaccine regardless of their immigration status. You won't be asked, at least in LA County, you won't be asked, and you do not need a health insurance at all. All vaccines are provided free of charge. So when you register for some of these, they might ask you for health insurance, and that might make you think that you need it, but you actually can just skip that part. If they can get reimbursed, they probably would want to, but it's absolutely not required. And what is the balance between individual choice and getting vaccinated and protecting the community? So community immunity, also known as herd immunity, is when enough people in an area become immune to an infectious disease, making it harder for infection to spread from person to person. Because of this, the whole community becomes protected, not just the people who are immune. It's how we stop the spread of diseases like polio and measles. Community immunity is important because it protects people who cannot be vaccinated, like babies and young children. It also helps people who may not respond well to the vaccine, like those with weak immune systems. So community immunity happens when enough people get vaccinated and or when enough people get and recover from the infection to build natural immunity. The percent of population that needs to be immune in order to reach community immunity depends on how easily the disease is spread. Typically, it's around 70 to 90% of the population. When enough people are vaccinated against COVID-19, the virus can't spread as easily from person to person. This means the entire community is less likely to get COVID-19. If by chance one person does get sick, there's less risk of COVID-19 spreading if there isn't enough people for it to infect, making the disease more rare.
So, Jocelyn, when you say community immunity, is that similar to herd immunity? Because that's the
Yes.
I keep hearing.
Yes, herd immunity, community immunity, the same thing. Yes, it's really the more people that are vaccinated protects the entire community. Now I'm going to go over some communication strategies. There have been a lot of reports out of the Philippines, who've had low confidence in COVID-19 vaccines. It's only recently begun to change. The Dengvaxia scandal is still fresh, I think, in people's minds when the government promoted a nationwide campaign to vaccinate children against dengue fever. It was linked to several children's deaths and created some distrust, I think, among Filipinos against the vaccines and government. And here in the US, I think we face similar struggles. Our government also has a history of creating harmful vaccine campaigns. These events can cause what we call social trauma that can be healed only by rebuilding trust. One of the most powerful strategies to increase vaccine confidence, at least here in LA County, includes the engagement of community-based organizations that have reached out to community members through phone calls, door-to-door door knocking, meeting people where they are to talk about their concerns and answer their questions. So I think this type of strategy is well suited for our Filipino community when we talk to others about misunderstandings about the vaccine. So in the Filipinx community, empathy is a very deep value and strength that we can use to help the people that we care about get vaccinated. We want people to make informed decisions since getting vaccinated is a personal choice. And to do that, it's important that they have good, reliable information and support. So in this last part of my presentation, I'll be discussing possible ways that we can talk to the people in our lives, the people that we care for and support, and getting vaccinated through better understanding and empathy. So how do you talk to someone who doesn't want to get vaccinated? I think really it's just having those one-on-one conversations. Use your active listening skills. Respect people where they're coming from. We're all trying to do our best and we're all trying to do the right thing. Share information. Try to share facts and bust myths. Share some of what you've learned today. Don't argue about it. Offer support. Acknowledge their concerns and share your story. Have patience. We all know that these kinds of decisions for some of us take time. And help give them access to the vaccine. Help them find a location where they can get vaccinated if they decide to do so.
Yeah, Jocelyn, this is such an important slide too, because I'm glad that you provided some examples of how to talk, because it's just, sometimes it's just so tiring and frustrating just to be like, why don't you just get it? Just protect yourself and others so that you don't have to like continue this pandemic even longer. So yes, patience. I'm glad that you added that because I require more patience to just like meet people where they're at is really the biggest thing.
Absolutely. And you can't think that it's going to happen over one conversation, right? I think, multiple conversations over time really does help. Here's some obvious things to not do. Don't be dismissive and don't and not listen to their concerns. Don't have the need to correct someone. Kind of just listen actively. Don't assume how much someone knows. Don't assume facts and data alone will change their mind. Don't provide information they didn't ask for or don't want. And don't overwhelm them with too much information too. Again, I think these kind of several conversations over time probably helps rather than like an hour of lecturing.
Yeah, the point of assuming how much someone knows. I'm in public health like scene, so, or environment, so I'm surrounded by people who just, I know that they understand. So it's good to step back and realize, where I live in New York is not the same as, mid in the mid states of the US.
Mm-hmm.
Where they have different values. And it's important to understand that some people see this vaccine as like a conservative versus liberal decision, which is unfortunate because it's not. It's based on facts and scientific evidence. So yeah, it's really important to understand that people are coming at this from a different point of view, and we just should not assume how much someone knows.
Absolutely. Exactly right. Again, more strategies that don't work. These might be like common sense, but I just wanted to put it out there. Not to use negativity and fear. Don't judge, coerce, or scare or threaten. Not use guilt and shame. Don't accuse someone of not doing the right thing or being selfish. Deals and promises. Don't promise that everything is going to be fine, because maybe won't. And this notion of normalcy. Don't assume that everyone it's back to normal for everyone. There are other competing things that people might be dealing with.
Jocelyn, that's so hard though. It's so hard not to provide all this information without like having to use a scare tactic, which I know is not useful for a lot of people. Yeah, I think the most important is also just active listening. What you said earlier is just hearing what their motivation is of not getting it, and then focusing on that point.
Exactly.
Yeah.
But I think this next slide speaks to that. Lead with empathy, respect, and support. So people want, of course, what's best for themselves and the people that they're caring for, and are trying to make the best decisions for them. So keep that in mind, that people may be more afraid of the COVID-19 vaccine than getting sick with COVID-19. So people may have experienced loss themselves, illness, things with their finances, or even the death of someone in their family. Getting vaccinated may be low on their priority list. they might not be ready to accept the recommendation to get vaccinated. So just understanding where they're at, I think is really important. So reach out from a place of concern, support patients, and not expertise and not hostility. Works much better that way, I think. Ask, listen, and acknowledge. Ask what questions and concerns they have. Ask open-ended questions and let them answer. So listen, let them express their concerns, take note of their beliefs, their fears, and what factors are impacting their confidence. And acknowledge, restate, and summarize their concerns. Acknowledge it can be an emotional or difficult decision, and the choice is really theirs. If people decline, respect that decision and offer to answer any questions that they have. And over time, if possible, check in on their decision. If you're talking to someone who's totally firmly in an alternate information kind of bubble, you might not be able to convince them or overcome their belief. You might not be able to overcome beliefs based on like conspiracy theories or rumors, but that doesn't mean that you failed. There's no surefire way or formula to persuading someone to get vaccinated. So maybe in a month or 6 months, people might change their mind. Again, having these constant conversations with them, or if they're trying to go to like a concert or to travel that may, in the future vaccination might be required, then they might do some rethinking at that point as well.
Yeah. Go ahead, Rachelle.
No, I love that you constantly bring up it's not just a one-time conversation, because this is like, especially with COVID, changes like on a day-to-day basis. So like they may be not open to hearing it now, but like to bring it up again, especially when it comes to something like, oh, I want to go travel somewhere. Like, yeah, they need to be aware of like, well, this is what's happening, so yeah.
Exactly.
Yeah, I had to travel to Hawaii, and they required either a negative test of COVID-19 or your CDC vaccination card, which I fortunately had. So I was able to show proof that I was vaccinated. Another strategy that I found was if they won't hear it from you, talk to someone that they respect and they trust, and talk to that person to try to convince them to get the vaccine. So
we're finding our ways.
Yeah, just different ways.
Absolutely. However we could do it. So here's I think the main takeaway is to use your personal stories and share why you got vaccinated. If you are a vaccinated person, you are a living, breathing example of the benefits of getting the COVID-19 shot. So examples are, you did it to see your parents, to protect your child who is at risk for COVID-19. When I got vaccinated, I had few side effects, but I understand that my body was creating a defense against COVID-19. Or for me, vaccination against COVID-19 isn't about my health, but also protecting my family and those around me. Or that you understand that you believe that the COVID-19 vaccine is safe and was tested enough and no shortcuts were taken. So you notice the theme of these are from yourself. This is you sharing your perspective. You know that it's not 100%, but it does protect you from serious illness and death. So really, I think focus on the big picture positive, that the vaccine is safe. Your chance of dying from or being hospitalized with COVID-19 really drops to nearly zero with the vaccine, and you're protecting yourself and the people around you. Again, here just reiterating, focus on the big picture and the positives. Again, your chance of dying from or being hospitalized drops to nearly zero. You're really, as more people are being vaccinated, schools and businesses, we can all be safer in these spaces that we all occupy. And fully vaccinated people, we want to make sure that we still do all of the safety precautions that I mentioned before, wearing masks in crowded areas. And now in LA County, it is required, according to our health officer orders, that regardless of vaccination status, that we do wear masks in public areas. They've been working on the vaccine for years, and it's really important to explain, that the technology that it's enabled us to develop the vaccine so quickly was in place many years ago. So in no way was there its development compromised because it was developed so quickly. Here are just some credible sources of information. I'm with the LA County Department of Public Health, so I did include our resources here, but you should, wherever you're from, also look to your local public health department for information. The CDC has some great information, also translated into several languages, including Tagalog. Here in LA County, also we have translatecovid.org, which is out of UCLA. They have a repository, just like so many materials available in so many different languages. So I suggest that you look to them as well. And that is the end of my presentation.
And Jocelyn, you were talking about resources. I was actually going to ask Leezel if you could talk more about TAIO, because I know that that's really a resource that I would go to as well.
Yeah, I mean, TAIO was created in the fall of 2020, and it was really in response to trying to combat misinformation. It really started with trying to answer the question of like, well, how do we, respond to like our titos and titas that are sharing, like, I just remember in the beginning of the pandemic, there was this meme that was going around, like, gargle, I think it was gargle warm water and you could get rid of COVID-19. And it just went viral. Like I saw it everywhere and it's like, okay, this is like, ridiculous. Like, if they're going to go share something, how can we be that another source of reliable information for our community? So that if they're going to share something, let's give them something that is actually vetted, that's reliable, and it's also accessible. And then I think the other thing is like it's culturally tailored to our community because it's great to have things like the CDC and World Health Organization like sources, but they're not always accessible. It can be very dry. I mean, it's very factual. So at TAIO, we really try to figure out a way, like, how do we make sure it resonates within our community, whether it's using food analogies to try to explain, COVID-19 and what it does, and also like the importance of, vaccination. So yeah, we've been working really hard in trying to keep up with all the changes. And I'm sure Jocelyn, like every day, I mean, I can only imagine in your day job, it's just like, it's constantly changing. So we've been trying to keep on top of it, but it's been a challenge, but yeah, so.
And I appreciate all of, our community-based organizations and our partnerships with them. They are like the key also to be that bridge between our kind of dry, often dense didactic material and really putting it in a way that people understand, especially for our Filipino community. So I appreciate that a lot. And it's only with our community partners that we're able to do this together, for sure.
Yeah, I had a quick follow-up question. I know this is a question that we've been starting to get through TAIO and in our related networks about booster shots. I know that's been a big topic of conversation as with the Delta variant cases rising. Curious, like, what has been kind of the communication, especially in your space? What are some things that people should be aware of?
Right now, there is no definitive plans about booster shots, but we are planning for them. At least the LA County Department of Public Health is planning for booster shots, even though there really is no direction or no, like I said, like solid plan to do so yet. But just know that it's probably coming. Just like, the flu, our immunity does wane over time. And with the variants now, it's another big factor in continuing protection. So nothing solid yet, but maybe expected in the future.
Rachelle, did you have any follow-up questions?
No follow-up questions from me. I feel like that was such a comprehensive presentation, Jocelyn, that it really answered most of, if not all, the questions that I regularly hear from my family and my friends. I really appreciate that you really provided some really concrete responses. So thank you.
Oh yeah, of course. And I lived this myself. I have family members who've also, forwarded me some information I know is false. But again, it really just takes a lot of time and patience, and stories. I'm fortunate that a lot of my family, they got it right away. I was one of those, making appointments when it was limited early on, like it was trying to get like concert tickets, checking the website every couple of hours to see if there's any openings. So I was fortunate that my family was really on board with getting the vaccine once it was available. But we know that some other folks need more time, and a lot more support and information. So it's my pleasure, totally. I think there was a question in the chat also about how to get translated Tagalog, or other Filipino languages, materials in those languages. So I mentioned, well, here at LA County Public Health, we do have our materials translated in Tagalog, because it is one of those threshold languages, one of the languages we have a lot in LA County. So we do have Tagalog materials available. Again, it's not, I actually work with a group of folks to tailor some of these materials so that it's a little bit more user friendly, and when you see it, you want to read it, instead of being faced with like just all this text. So there are materials at our LA County Department of Public Health website. I mentioned that the CDC also has Tagalog translated materials, as well as UCLA's translatecovid.org. But if there are other resources you all can share too.
Oh,
New York. Oh, go ahead.
Okay. I had one follow-up question. It just
yeah.
came to mind. At TIO, we've been really focused in the beginning, really honing in on the vulnerable communities, especially that have been impacted impacted by COVID-19 within the Filipino community.
Mhm.
I know more recently, and maybe you could speak to some of the numbers, trying to really combat some of the hesitancy still within the vaccine, taking the vaccine. Where are you finding that it's now really the Gen Z or younger generation that is like more hesitant, and how do you have any tips or advice to try to reach that next vulnerable community?
Yes, it is. It is the younger generation. I think that we're seeing the more cases of. I don't have the exact numbers, but definitely they're the people that are now actually getting more hospitalized from COVID-19. I think what the argument I've heard is that they're fine, they're young, I'm healthy. Even if I get sick, it's not going to kill me. But we want to emphasize that it's just more than your own immunity in getting vaccine, right? I think we've talked about community immunity and how every person sort of helps build that herd immunity factor. And again, to just end this pandemic already, to stop further variants from being created and spread. I think it's so important that people realize, their actions are not just they affect not just themselves, but other people as well. And so I don't know, it's hard reaching young folks. It's younger folks. And again, we have to listen to where they're at. There might be other competing priorities in their lives, and taking all that into consideration. But just having those conversations over and over is a good way to go.
Yeah, I think that would actually be a good point in terms of moving on to our main takeaways from this episode. And the first one that I wanted to share is what you just mentioned is, how do you talk to someone who doesn't want to get vaccinated? And that's really approaching them with empathy, respect, and understanding. And another takeaway from the episode is, the common misunderstandings of COVID-19. There's no microchips, it doesn't cause infertility, and you can't spread COVID-19 from the vaccine. And then the third main takeaway is that vaccines are safe and effective. It protects you, your family, and of course, our community. So again, Jocelyn, this has been such an informative and fun episode to really feel that, okay, there's other people who feel frustrated and who feel and experience the hesitancy from our own family and friends. So thank you again.
Of course, my pleasure.
Yeah, thank you so much. This has been such an informative hour, and I hope everyone that is watching and listening to this will take away many things as we kind of move through this pandemic. Yeah, so please, I hope everyone continues to listen to this podcast. Our next episode, episode 8, has to do with bereavement and processing grief during COVID-19. That will be on Saturday, August 14th, 2021. And it will be at 11 a.m. Pacific Daylight Time. And that features Andrea McKee, Elaine Dolalas from TFAL podcast, and then Dr. Rachelle Concepcion. So thank you again. I can't thank you enough, Jocelyn, as well as Rachelle. It's been such an illuminating conversation. I hope you guys had a great time. I know for me personally, combating misinformation is a daily challenge and struggle as a member of the media that is, trying to serve everyone with the facts and the truth. So thank you again for all your work in your respective spaces. Just a quick reminder to follow us on social media at Fil-XAO_CHA and like us on Facebook. Thank you again. Thank you to AAPCHO, the Walmart Foundation, as well as We Can Do This, and the Department of Health and Human Resources for making this podcast possible. So thank you again.
Thanks, everyone.
Thank you.
Again.